Good afternoon and welcome to United TV. It's our Bariatric Friday, 3 p.m. We are in our new studio and Dr. Irgau is here, not the first time, but in this first time for the new settings. So hopefully everything will go smooth and we'll have him in. All right. Dr. Irgau.
Boy,
So
am I excited. This is wonderful.
To the new setting. So
Love it.
is going to be almost like the TV studio now. So
And the best.
we'll try to improve it. So, well, you are committed to what we are doing from the clinical side, and then it makes it, when I see people putting a lot of effort in my team, it makes me, like the way that I feel is that I want to do more. So I feel like if I see you coming here every week, because many people don't understand this, so for us to be able to make your schedule in a way that you are able to come here, and you still have other responsibilities when you leave here, and it's not every surgeon wants to do or is able to do.
Well, it's my pleasure.
And then because of that, I want to do better every time. So we are going to improve. And of course, I have a great team here. Ethan did a lot of things with Zal in the studio here physically. And then our team in Turkey, Ali and John, they also put a lot of efforts on the software upgrade. So we are using a different software for the in-person event. So I am thankful for all the work that our team is doing for us. So today we are going to talk about the resolution of comorbidities, post-bariatric surgery. So many of you already know that we have discussed, and we are going to discuss more in the future sessions. Bariatric surgery, although we say it's not magic, but it's magical in so many different ways to see the resolution for other illnesses that comes with morbid obesity. And most common of these are diabetes, hypertension, sleep apnea, hypercholesterol, joint pain, depression, liver disease, so many really important illnesses. It usually comes with either morbid obesity makes it more complex and complicated, or it's happening because there's morbid obesity. So because we covered other, like this is our new cycle, and then we start with new, like our regular topics. So assuming everyone watched what we had before, so we are going to kind of focus on the resolution of comorbidities. And if you can kind of give us the background on these issues first, and then we can start from there.
Absolutely, absolutely. You know, many people may question the idea of going to the doctor to lose weight, right? To say, why do you need to see a doctor to lose the weight? Well, because first of all, it's very difficult to lose weight, particularly when people reach certain levels of weight, but also more importantly, because once we get to a certain weight, we also develop very serious illnesses that we're calling comorbidities, right? These are illnesses that come with obesity. In fact, Kemal, a better term for this would be to call them complications of obesity, because sometimes when you say comorbidity, it suggests a coincidental presence of two entities that may have the same background, maybe the same risk factors, but they may not be causally related.
Right.
But the key issue here is that when we talk about these illnesses, obesity actually is directly causing those illnesses. So they should be called complications of obesity as opposed to comorbidities of obesity. And what happens essentially is when the accumulation of fat in our body exceeds a certain limit, it becomes an inflammatory process that instigates really the arisal of all these illnesses that you mentioned, metabolic conditions like type 2 diabetes, cardiovascular problems like high blood pressure, heart disease, and of course we talk about sleep apnea, and you mentioned many problems with joints as well, and liver disease, many problems. And of course our traditional approach as doctors has been to treat each one of these illnesses as if they were all independent and separate, right? Well, now we know better. We know that if we are able to take care of the central problem, which is obesity, then we will have resolution of these problems as well. And that's essentially what it happens after bariatric surgeries. The person comes in with a very high body mass index or a lot of weight. They have bariatric surgery. They lose weight. They lose 60 pounds, 70 pounds, 100 pounds, 120 pounds or more. And as the weight goes away, so do these illnesses that have been caused by obesity, essentially.
Right.
And we obviously focus on this greatly as doctors. Of course, we're happy to see patients lose the weight, having a more comfortable life, more self-confidence, liking themselves, shopping for clothing that they like, right? All these are good outcomes and good things. But where we focus as doctors, Kemal, is what happened to the high blood pressure? What happened to the type 2 diabetes? What happened to the sleep apnea? And with bariatric surgery, we see these illnesses either going away completely or become much, much more improved from the way they were before the surgery.
So let's start with type 2 diabetes. Now, so people can have type 2 diabetes even if they don't have morbid obesity. But when they have morbid obesity, we are assuming, not assuming, but we know clinically that they are connected. So, and the surgery, bariatric surgery, can have a almost magical impact on type 2 diabetes. So can you just elaborate that a little bit?
Absolutely. So type 2 diabetes is a medical condition where there is a rise in the level of sugar in the person's blood that the body cannot control. In a normal situation, Kemal, whenever we eat, the blood sugar goes up. And when the blood sugar goes up, it signals to a part of the body called pancreas to release something called insulin. Insulin is a hormone that comes in and opens the doors of cells for sugar to go into the cells. So the sugar that was circulating in the blood and that was rising in its level, then it comes down. Because having a high blood sugar by itself is very deleterious to the body. So the body has a very good mechanism for controlling the level of blood sugar. But this mechanism becomes disrupted when we gain weight. We become insulin insensitive. In other words, the insulin that was able to open the doors of the cells to let the sugar go inside the cells rather than hang in the bloodstream, the doors of the cells do not respond as well to the insulin. So that's why we call there is decrease in insulin sensitivity. And this is caused directly by the fact that we have too much fat in the body. Now, too much fat in the body is not just fat that weighs and does nothing. It's actually active. It's metabolically active. It releases different, what we call inflammatory substances that interfere with the insulin's ability to open these gates of the cells so that the sugar can go in, right? So what happens is insulin is not efficient, right? The blood sugar rises and the response of the body is to produce more insulin. So we have more insulin. So the more insulin we have circulating, the less responsive are the tissues like muscle and liver to actually take in the blood sugar and lower the blood sugar, right? So we have this vicious cycle in which the blood sugar goes up, the insulin is not efficient, we ask the pancreas to produce more insulin, and at some point, the insulin-producing cells in the pancreas are exhausted. They don't work anymore. So you can get into a situation where the person that has started as type 2 diabetes, where they did not need insulin for them to be treated, now they cannot even produce insulin themselves, right? So they become insulin dependent at some point. So the vicious cycle that starts type 2 diabetes is the presence of excessive fat. That's where it starts, right? And how do we solve this problem? By getting rid that source of inflammatory substances that has been interfering with insulin's ability to take care of the blood sugar in the bloodstream.
And this is what we have seen with the outcomes of the patients when they come and see us after the surgery, and we see them so often right after surgery, and then it goes to the annual checkups. What's the timeline to see these resolutions?
So it's very interesting. When you look at what happens to type 2 diabetes, there are two different situations. In one setting, you could see actually improvement of type 2 diabetes almost overnight.
Mm-hmm.
That happens with certain procedures that actually require diversion of the intestine, like gastric bypass. You can have somebody having gastric bypass. They were taking a lot of insulin the day before their surgery because of blood sugar was high. And then on day one after surgery, their blood sugar is normal without any need for insulin. That happens because the rerouting of the intestine creates a hormonal situation where the insulin sensitivity increases greatly overnight, right? This doesn't happen with everybody, but many patients experience that.
And this is the reason when they have diabetes and they're at a certain age, we may go with
gastric bypass, definitely gastric
as
bypass.
the primary one.
Absolutely, it's much more efficient. The other mechanism whereby type 2 diabetes improves is just pure weight loss, right? As the weight goes away, as the person becomes lighter and lighter, as there is less and less excess fat in the body,
Mm-hmm.
the body becomes insulin sensitive, right?
Right.
Which means that the blood sugar doesn't rise quite as much, and there is no need for medication. So this mechanism can occur over 6 months after the surgery, although the improvement is seen really within the first few weeks. Very often, our patients will call us and saying, when do I start my diabetes medication right now that I have had surgery? And the first question we ask them is, have you been checking your blood sugar? And they will say yes. And we ask them, what is your blood sugar level? They say, well, it's fine. Then we say, don't take the medication. And on other situations, we may say, well, you still need some of your medication, but you don't need as much. And as time passes, they need less and less medication. But generally, the timeline would be anywhere between the 3rd and 6th months after surgery.
That's great.
Yeah.
So when after the resolution, would they come back? What's the chances of these comorbidities coming back? And why, if so, why it would happen?
Well, essentially, the main problem was the excess accumulation of fat, right? We did the surgery and we got rid of it. But as we say very often in our program here, bariatric surgery is a very powerful tool, but it's not a magic wand, right? Which means that it is important for the person to incorporate key lifestyle changes that we want them to uphold for the rest of their life.
Right.
If they fall off from this type of commitment, it is possible for them to start regaining weight. And guess what? As the weight comes back, the weight starts causing the same complications that it caused even before the surgery. So yes, these conditions can come back, even to the levels, to the pre-surgery levels, if the person is not careful. Now, this is not very common because bariatric surgery is a very efficient way for losing weight, and the vast majority of people are actually able to keep their weight off, or the majority of their weight off. So we don't see really this condition is coming back, but they can, just as the person is able to regain weight if the person is not careful long term.
So now the way that these complications, the patients who are fearful with these complications, but also they actually can benefit the bariatric surgery the most. How do we handle those types of patients? What's the way of counseling them? And since you see these patients in the office, when they are in the exam room, how do you handle those?
I think first of all, it's very important for the patients to be educated about the long-term effects of obesity, right? Obesity is not just a question of inconvenience or appearance. It is a disease that causes many other diseases, right? So, and that trajectory is clear, right? We've seen it play time and time over. And patients will also tell you that, when their weight was a certain level, they didn't have high blood pressure. When their weight was a certain level, their blood sugar was normal. When they start gaining weight, those conditions come. Now, we have to educate them. We have to make them understand that these conditions are not harmless. Not only they are dangerous conditions that will have an impact on their quality of life, but they can shorten their life expectancy as well, right? With high blood pressure, you have potential for stroke, you have potential for kidney failure, you have potential for heart attacks, right? And with type 2 diabetes, similar problems as well. We have to make them understand that these dangers, no matter how much medications we throw into them, are going to be there. And we make them understand that bariatric surgery can go a long way to help them get rid of these risks and of these conditions. Of course, patients are going to be apprehensive with the prospect of surgery, but when we explain to them that bariatric surgery has been brought to a level of safety now that is really unprecedented, so much so that complex procedures like the sleeve gastrectomy or even gastric bypass carry the same type of risk profile like gallbladder surgery or knee replacement surgery. And when patients understand and see that, and when they compare that with the risks of staying obese and also staying with these diseases, then they are able to navigate through their anxiety about the surgery a lot more easily.
Now, when we look at the long-term impact on these outcomes, we recently have a study just to make sure that our data is most up-to-date. And as everyone knows, there's a national level accreditation, so we have to report our outcome to the society. So now, what I have seen, this is kind of very interesting, and although just so that patients don't feel like, hey, are we isolating them or are we isolating ourselves from them? So I think the other day I told someone, it may be one of the meetings with the insurance company, I said, you know, we say all these, and then sometimes we want patients to do certain things in a way that we want them to do. But when I become a patient, and I'm one of the worst ones in terms of not listening to my doctors. So, you know, if you remember the whole colonoscopy issue, first I was given the Cologuard. That thing sit in my office, home office, for almost 6 months. We were just staring at each other, and I said, you know what? I'm not going to do you, so this is not going to happen. So, and then in the meantime, my primary care is following up. There is like, you know, nothing went to the lab because I didn't do it. So then it's like, okay, fine, we'll just do regular colonoscopy. So then waited for a year to get that done. And then once I had the appointment, I went there when I was chewing gum in the morning, although I did all the preps and everything. So I had to, you know, go back and reschedule. So I'm not the most compliant patient, and I can understand when patients don't want to follow up on certain things. But when it comes to surgery, when I have to take this decision to resolve the problem with surgery, because this would be the most effective way of doing it, then I feel like even someone like me would become a better patient. Why I say this is because we want to see these resolutions for long term. And how we can actually make that happen is if they follow up with us after the surgery. Usually the first 2 weeks and the 30 days and even the 90 days happening. But then once they start seeing the results, the reason, again, why we know this very close is because you know, I want to see at least their 12 months process. Well, half of the patients didn't show up for their 12 months follow-up. And I don't have any way of reporting this. So that's one of the problems. So even if you have a positive return after surgery, you still need to follow up with your regular appointments. These are just annual checks. At least we would be able to help you before it becomes more problematic.
Absolutely.
Before it becomes like a weight gain issue. So doesn't mean that you lost 100 pounds in 6 months, because that's what we are seeing. you still need to follow up. So
Absolutely.
we can actually, we may engage our nutritionists post-surgery. So those are kind of what, how we are going to make this happen. Now,
Excuse me.
As you know, my mom had surgery now 2.5 months, and the recovery is tough for her. So it's not a bariatric surgery; she had heart surgery. So, but I'm looking at how careful she is now, even though things are almost back to normal. But before, when we were, when she wouldn't listen to us, hey, you need to get up and then you need to do X many steps. Now she has an iWatch, and then we check everything, and then there's someone who's monitoring because she saw how bad things can get.
Absolutely.
So that's why I was saying earlier, if I have no other options, or if I have to go with the most efficient options, and if that's bariatric surgery, we need the full commitment before and after surgery. That's going to ensure the outcome for long term. And like depression is, we didn't talk about, but depression is, many people don't understand how this is related. Once you explain it, they're like, oh, that makes a lot of sense. The insecurity, not being happy with yourself, low self-esteem, and even today when our camera angle change, I have to make sure that I don't look more than what I am, and I'm checking myself there, because that's not what I look like in person. Right. So that means, but if I become heavier at some point, and if I have to live with it, then I know it's going to be a problem long term.
Of course,
but that's one of them is the depression, and being able to go back to what we're able to do in terms of socializing, in terms of one-on-one relations with others. So this has a huge impact on the individual in terms of managing the depression that most likely caused by morbid obesity. So, but this is why we need people, our patients, to have full commitment. And when I was helping my new assistant for the projects with the BMI, we are going through some of these, and 100 pounds, 100 pounds in 6 months.
Absolutely.
That's miracle.
It is.
Right?
It is. Absolutely.
And on top of that, this procedure is not something that someone needs to stay in the hospital for a month or for a week. So they go home same day.
Yes.
So what else can we do? Right?
Absolutely. I think it's all again about education and for people to understand also. I think we are making some headways, not only in making sure that the public understands, but obviously even within our own health profession, we have to get people to understand that obesity is a central problem that is driving so many of these illnesses. And just telling people to lose weight is just not enough. It's not enough because it doesn't work. People will come after a lifetime of struggle with on and on, gaining and losing, gaining and losing, gaining and losing, and then they find themselves really at very high levels, right? And they feel defeated. And as you said, by that time, they will have developed so many other medical conditions, and they will be on different medications. And those medications, frankly, they are almost patching up rather than helping them, right? When you're taking medications for type 2 diabetes, all you're doing is you're trying to force more of the sugar into the cells, but the insulin resistance keeps going up. You're not solving that central problem.
The body is able to adjust.
Absolutely. So getting rid of the weight makes so much more sense from that point of view. And then, as you said also, longevity. I mean, it has been clearly shown in many studies that bariatric surgery actually increases the lifespan of people, right? On the other hand, it has also been shown that obesity decreases the lifespan of people, right? The higher the body mass index, the lower the chance for a person to achieve their full life expectancy. So with this information at hand, I think we are able to inform people, we are able to educate people. Of course, we're not saying that just bariatric surgery is the answer. Far from that. We're saying that a comprehensive approach where bariatric surgery is part of that approach, is critically important. Of course, we are going to help people. We're going to help the providers also select the patients that are going to be best served with bariatric surgery, because we have the data, we have the experience to support it, right? But we have to make sure that bariatric surgery is part of the options that are presented to patients, because it's a very, very effective treatment.
Right. So when you were going through that, and I know, I think we covered the resolutions. I think that since there's a playlist on the channel related to the resolutions, so there should be at least 8 of them. So people can get more information from that, from those playlists. So, but I couldn't help but wonder when you were actually explaining this issue with, think about this way. So you have the surgery, and pretty much the surgery doesn't bring you any additional risk. Not only that, it actually, destroys those problems that we already have, right? But when I have a patient on a weight loss medication, every medication comes with side effects.
Of course. Of course.
So the surgery's side effect is the resolution of comorbidities. But when in the uncontrolled setting, I want to be careful there because we still support the weight loss drugs. But if it's in the uncontrolled setting, meaning no one is measuring them, following up with them, and no nutritionist on board, and the patient is on this medication for 2 years with no outcome, that's dangerous. Would you agree?
Oh, absolutely, absolutely. Just like the proliferation of online dispensaries that are really telling people, encouraging people to get those medication with remote supervision. It's not really appropriate. You need a programmatic approach where changes in lifestyle, education about nutrition, close follow-up are really part of it, right? And we shouldn't be, and it's not necessarily medication versus surgery versus other things. I think these are all options that a program that is experienced in weight management should be able to offer patients, right? And unless it's done in that setting, obviously you are setting up people for failure. And as you correctly said, some patients could be on this medication for quite some time without proper follow-up. And not only, obviously, you worry about potential side effects that could be harmful to patients and not being detected in time, but also the fact that these patients are just getting the potential for side effects without getting the benefits of this medication is because appropriate supervision is not being provided, essentially.
Right. And also the cost.
Of course.
So $1,600 to $2,500 a month. If you see a result, go for it. I mean, this is again, it works for some, it doesn't work for some. So you can try, and then we do that as well in our offices.
Of course.
So we also have a bariatrician in the program under the United Medical ACO. We have actually 2 bariatricians, one in Seaford, one in Wilmington. And if medication works, that's great. But the thing, in many of these cases, we are expecting this miracle, magical, I'm going to take this pill and then I don't have to do anything. I'm going to eat everything the way I, like right now, is what time is it? Like 3:30, 3:40. I didn't eat anything since last night. So I'm pushing the 19th hour.
Good for you.
So it doesn't happen easily. So, and this is Monday through Friday. So like just Fridays, maybe a little bit longer, but it's still 17, 18 hours. This week, because of the cold, we couldn't walk. So I have to be a little bit more careful because I don't have enough steps. So this is, nothing is magical in this case. Nothing is magical.
Absolutely.
So that needs to be understood by everyone. And and this is also true for the surgery, but the surgery doesn't come with side effects. So someone who's 57 BMI shouldn't be on medication only to see that if they're going to lose 15, 20 pounds. That's not how it works. Now, we have another study that we are working on with our own patients in the ACO to see how the progress is for them, how much weight loss we are able to see. And then we are going to share those in the future episodes. Now, one of the really exciting updates from our side is next week we'll have Karen Riley, who is one of our patients.
Absolutely.
Who's going to join me in here in the studio. So we did record something with her, and there were some technical issues with the connections. So then we asked her if she would be willing to come and do the session here, and then she agreed to do it. So
that's wonderful.
And she's someone who has seen a lot of positive outcome from her own journey, and we are going to share that with everyone next week. And then we have other sessions coming up. Now, morbid obesity is a chronic illness that impacts a lot of things in our body and how we are managing day-to-day activities, to psychological issues, to other chronic problems. So the solution is very simple. There are different solutions, but if at a morbid obesity level, the surgery is going to be the best options. Doing that with a program that's multidisciplinary like ours. And anyone actually has a different, if I'm not actually accurate with what I say, I'm going to say this. We are the only bariatric program who has daily case conferences, and all patients are being discussed on a daily basis. And I'm there, you are there. Our nutritionists, our nurses facilitate the practice. There's no other place in the United States who's doing what we are doing in terms of prepping the patient for the surgery. So I think this would be the easiest place to do it and safest place to do it. So take advantage of that. So we'll be back next week with Karen Riley and Dr. Ergau. Thank you for again coming to the studio and being with us and very educating us. So this setting is going to get better. I'm going to have the right angle on the camera. So, and we'll see you next week. Thank you for being with us.
Of course.